Dr. Lund, the mayor announced today he has prostate cancer and he's going to be getting treated. He told us that he was diagnosed at a pretty early stage. What can you tell us? You're the physician that's been treating him for a while for this, from what we understand. What can you tell us a little bit about his health and his prostate cancer?
Yeah, so Joe Schember has been, he's a very generous guy. One of the things when he announced or told me that he was going to announce his illness, he did it, I think, for interesting motivations. He did it because he really wants to build the awareness of prostate cancer among the community. And so I think he's using his position to actually make the community more aware of it. And he did the kind of standard men's health program. He was seen yearly for the typical prostate symptoms that men get as they age, and in the process we were doing the typical exam, which is a rectal exam and a PSA level, and he was doing very well with that until this last one where there were some abnormalities that showed up, and so he then underwent the subsequent diagnostic testing, which included transrectal ultrasound and biopsy of the prostate. So for that, I give him great kudos for just sort of not only doing the normal men's health program, but also making his illness to the community.
We asked the mayor if his treatments would take away from his duties as mayor, and he said it would not. There will be some times where he'll be at home and he'll have to do the radiation, maybe 15 minutes, Monday through Friday. Could you explain his treatment regimen that he'll be going?
Yeah, he's going to get a combination of both a surgical treatment and radiation therapy. But I agree with what the mayor had explained to you, is that it should be not really interfering with his duties as mayor, and his recovery time, even from his surgery, which really is only to improve his urinary symptoms, not really to treat the prostate cancer, should be very short recovery, and he should be able to get back into his office very quickly. In terms of the prostate cancer treatment, I have plenty of patients, just like Mayor Schember, that conduct a full schedule of activities during the entire time that they're undergoing radiation therapy. So it should not interfere with his activities.
For someone who may not know, just explain to me a little bit what prostate cancer is exactly.
So the prostate is a gland that sits at the base of the bladder that men have that surround the channel that they urinate through. And it has a glandular component that is susceptible to forming cancers within that gland. It generally affects men in as early as their 4th decade of life, but it is more prominent as they get into older years. And this is where Mr. Schember, he's going to go through radiation therapy, but I like to explain to patients that prostate cancer is a little bit like a tailor-made suit. There are several factors related to prostate cancer that really dictate the underlying treatment modalities, whether they consider surgery, radiation therapy, and in some patients we even just observe them, where we don't even treat them for their prostate cancer. We have the advantage now of even doing genetic testing of prostate cancer to determine whether this is a cancer that will be clinically significant, meaning is it going to hurt them in the future. And so that Mr. Schember didn't go through the genetic testing, he didn't have to, but some men, we recommend that. So we've been able to refine our treatments and our options for retreatments based on that new information.
The treatments that the mayor is going through, I'm correct, it's, from what he said, it's the TURP procedure?
Correct.
Followed by 6 to 8 weeks of weekday radiation, 5 times a week?
That's right.
What, I guess maybe take us through what the procedure he's going to undergo, and it's not removal of the entire prostate gland, is it?
Correct, and that's why he needs the radiation. So he's really getting the transurethral resection of the prostate because he has significant voiding symptoms that are really interfering with his life. And in fact, before he came mayor, I actually had him set up to do this procedure, but he then postponed it because of his duties. This is an elective procedure. But our fear was that if he went through radiation without this, he would not be able to urinate. So we're doing this in preparation for the radiation therapy. Yes.
Did he have symptoms that led to him seeing you?
Well, he had not symptoms of prostate cancer. Generally doesn't have symptoms. It's a silent disease, but he had urinary symptoms that we had been treating him for a number of years. Yes.
He said for an enlarged prostate.
Correct.
That's the right.
Yeah.
He's okay.
Yeah.
And is this expected or common in most men, or?
If guys live long enough, it's inevitable. All men get prostatic enlargement and gradual and progressive symptoms of urinary symptoms.
When you hear the word cancer, you sort of shudder and say, oh my gosh, but prostate cancer is one of the cancers that is definitely curable if detected early.
And I would tell you, Mayor Schember has that. He has a disease that should be cured and he should live a nice, healthy, long life without prostate cancer after treatment.
And what kind of actions should you do, like if you detect it, say you detect it late and you know it's already kind of serious, what kind of things do you think you should do for that?
So, in many ways, okay, so when we detect prostate cancer, we preferably would like to detect it early, like Mayor Schember has. And I think that's the virtue of what he has done, is to build awareness so we do detect it early and then we have the options. But if unfortunately we detect it late, after the disease is not in a state that can be cured, I like to also, most of prostate cancers can be treated in a sense that becomes more of a chronic disease rather than a life-threatening disease. I make the analogy, think of it like hypertension or diabetes, that it could be a lifetime treatment, but we can actually control it so it doesn't limit their lifespan or their quality of life.
And the mayor is reaching out to people to get checked. Maybe some men believe that they don't want to go through the finger kind of thing that the doctor does, but doctors really aren't doing that much anymore. Is it all a blood test now?
No, we're still doing, okay, so there is some controversy in prostate cancer, and we've gone through a period of time where there was a recommendation that screening for prostate cancer was not advised. But the screening for prostate cancer was in reference to doing a solitary blood test, that the PSA, the prostatic specific antigen, in and of itself, without any other additional evaluation, was considered a low-level accuracy test. Put that together with digital rectal exam and yearly exams following men over time, it becomes a much more effective way of detecting early cancer. So that's really what we counsel men on doing, not the solitary blood test.
How important is it to share with let's say you're not seeing a urologist, you're seeing a family doc just as normal, to be in communication with them about urinary problems? Because sometimes that's the first issue, is that there are some urinary problems, correct?
Yeah, so interestingly, one of the new CMS, which is the federal government's recommendation on quality measures, is urinary symptoms that is coming out this year. So this will be actually within sort of the quality measures that a lot of family doctors are living under, will be the evaluation of the urinary symptoms. So it is an important aspect of things that needs to be taken care of.
So if you're having problems, if you're a man of a certain age and you're having problems either with need to go too often or having trouble going, you need to tell your family doc, right?
Correct.
The procedure that the mayor is undergoing, that's usually just, it has to stay overnight?
Yes, he would have to stay overnight. It's considered an outpatient procedure, but it really is a 23-hour, quote unquote, 23-hour procedure in which they stay in overnight. And that's really for observation of any significant issues postoperatively. It's a rare event, but we need to monitor them closely during that time frame.
He was indicating his hope that he was going to be able to go to work in the morning, go to his radiation treatment, and then come back to work for the rest of the day. Is that feasible?
Yeah.
Okay.
I think that's a very... I have construction workers that show up at the cancer center at 7:30, get their radiation, and are on the job site at 9. So it's... I would expect him to be able to do all that.
What are common side effects from 6 to 8 weeks of this type of radiation?
Yes, so towards the end of radiation, there is usually some fatigue. Usually there's some urinary frequency, sometimes some bowel frequency, but it's usually self-limited to about a 2-week window around the end of radiation and just after that. So it's usually not severe. It's easily treated.
Hair loss?
None of that. So this is not like a systemic treatment where, because it's radiation is still a localized treatment, they don't get the systemic effects of nausea, vomiting, weight loss, hair loss, etc.
And chemotherapy is not effective. Chemotherapy is not usually a treatment for this
Yeah,
at all, is it?
well, in metastatic disease, there are chemotherapy protocols that we do, but not with Mayor Schember's.
And he indicated that it was 12 samples were biopsied, 2 came back malignant,
right?
And that were any lymph nodes?
No, this is a sampling of the prostate only, not of the lymphatic system, and we really go by a series of testing that we've already done on Mayor Schember in terms of his blood tests and so forth. So statistically, we know that the chance of him having lymph node disease is 0.
So basically, this is local. Is it localized? Is the right term?
Yes.
Not even regionalized. It's localized prostate cancer,
yeah.
Which offers the best odds for 5-year survival.
Correct.
Okay. Surgery is scheduled for January 30th?
Yes. Without my chart in front of me, sometimes I...
Not a problem. What advice, Dr. Lund, do you have for men who may have issues like the mayor had? I mean, is this something? What's the first step they need to take?
So, they need to follow up with their family physician if they're having voiding symptoms. Not that this necessarily indicates prostate cancer, but they need not to suffer with voiding symptoms if it's a significant issue for them. The other thing is that really we should rethink the whole aspect of screening for prostate cancer. There was a hiatus that was taken based on the controversy around prostate cancer, and unfortunately we're finding more prostate cancers because of that hiatus. So now we need to again step up our game in terms of looking at that. So that means if you have a first-degree relative that had prostate cancer, a father or a brother with prostate cancer, you definitely need to be screened once a year with rectal exam and PSA. If you have, if you're African American, you run a higher risk of high-grade prostate cancer, and you should definitely be screened once a year for prostate disease. And if you've had elevated PSAs in the past for whatever reason, you need to get back into your doctor and start continuing to be evaluated.